Okay, so this website is the University of Maryland, and I could totally share this with you all. This is a free, open, public website, and I'm going to show you the faculty side of it as well as, the student side. So again, University of Maryland School of Nursing. So they have a next gen test bank. So there's different case studies here. And so say, for example, you wanted to do acute respiratory because that's something you need to practice on. You would click on it and it will take you through the questions one by one. And these are the case studies because that's, I think, one of the things that is a little different for the next gen, the fact that you're going to have 3 case studies. And each case study is going to have 6 questions. So this takes you through the process, and some of you have done case studies with me before in previous sessions, so you're like, oh yeah, this looks familiar. And so you can answer it, and you'll go through all 6 questions. And then I'm going to show you how to get to the answer key, because this is something I can share with you. You don't necessarily need me, because this is a great group. I know you all know what you're doing. But if you go to the faculty case studies, it breaks it up for you and it gives you the answers. So let's go to med-surg. We did acute respiratory distress. So the answer key is always in a document format. So I would, just for the sake of testing yourself, do the questions first and then look at the answers. And so this gives you the case study, all the information, and the answers you can see are kind of starred here. So you'll know if you have chosen the correct answer. I like this because it also tells you the scoring rule, because that's something that you want to understand on how it is scored. Okay. And it goes through all of them, and it just a little asterisk tells you, okay, this is the one that I should have chosen. That's the correct answer. And it also gives you the rationales. Okay. And it does this for all of those case studies that are listed. Okay. And this is really great. Like if you're concerned about these case studies, I would definitely, take one section at a time. And maybe, I know some of you may study together. You could jump on a Zoom and say, hey, let's work this together. I know I've done a bunch of these with Erica, and like she's fantastic at breaking these down. And I've actually had a lot of fun with her as she broke these down. So that's just another way that you can study. So it has like family. So this is all like mother, baby, and kind of peds. Fundamentals, mental health, right? These are great case studies. Med surge, a lot of med surge, and then community is like your safety kind of scenarios. Okay, but I think this is a great website, and that's how you can navigate it from the student side and from the faculty side. Any questions about that? Okay, and so that will kind of help you work on that kind of thing. Okay, so I'm going to stop sharing, and I want to get some feedback from you because I do want to go over some questions today, or I want to go over what you want me to go over that would help you. So Amber, let's start with you. What do you think would be helpful? And also I can pass that on to Mrs. Patterson as well, because we're tailoring our sessions to what your needs are.
I'm just listening right now.
Okay, I understand. Amber, you sound like me. I hope you
Yeah,
feel better soon. Okay,
thank you.
you're welcome. Okay, Bria, I know that you're just jumping in. You had some good downtime, so I think that's good. But what do you think would be helpful?
Honestly, I don't have a preference at this point. I feel like me refreshing any and everything would be great. So I don't have any type of like specific areas of concern just yet.
Okay, got it. Okay, thank you, Jessica.
Uh, well, I know my two weak spots are maternity, and then I feel like I do pretty well on like renal and diabetes, but I also feel like you can never know enough on that subject.
Okay, renal and diabetes. Okay. Okay, thanks, Jessica. Okay, say.
Yeah, I'm with Jess on the mother baby stuff. 'Cause, I don't remember much of it anyway. And probably stuff on like the whole diabetic stuff and kidney failure.
Okay, so the same thing that Jessica said. Okay, got it. All right, thanks, Say. Okay, Sarah?
Yeah, mother baby. From what I can read of all of the things I have tested on, is the one I'm most difficultly struggling with. So everything else I kind of work with where I'm working at, but that is something I'm struggling with.
Okay, good. All right, so we'll do some mother baby questions because that sounds like that is the thing that you want to know more about. Okay, so one of the ways that you can study mother baby, um, you probably, I know that I've worked with you all before. One of the things you could do is Kathy Parks. She has, I think it's like 36 videos from Mother Baby. Like if you feel like you remember nothing from Mother Baby, I would definitely recommend going over that. Um, those sets of videos. Let me just put that link in the chat. And it's something like if you just need like a quick refresher, you could listen to it in the background, like when you're, doing whatever, getting ready for the kids for school or whatever the case may be. Or I'm going to put the link in the chat, but because I listened to those videos and it's actually done by her friend Maris, her partner. Okay, let me share my screen. Okay. And the videos, they're pretty good. Let me see, pediatric nursing. Okay, maternity nursing. So yeah, it's 39 videos. And of course they're short, but they're really good. And it starts from, I think, when you, in the beginning, you think about contraception and all of that, it starts all the way from the beginning. So if you're telling me that you're concerned about mother baby, then definitely review all of those videos. The other thing I would say is you're going to see a lot of reduction of risk kinds of questions with mother baby, like recognizing that the mother is in danger, recognizing that she's hemorrhaging. That is a huge kind of reduction of risk. Okay, so let's do some of these questions. Um, so this also, when we go over these, if you feel like, man, I don't remember this topic, then we can go over it. Or as we talk about it, you may be like, oh, okay. But let's go ahead and put your answers in the chat. You should be able to see question number 1 right now. Okay, I see. All of you got it. Okay, so excellent. Okay, I'm just gonna put the rationales in the chat because of course, um, rationales are what you need to get because you're gonna see this again, right? Okay, Say, do you want to walk us through this question? Everybody got it right, but what was your thinking when you saw this question?
The nurse. All right. This is 1, right?
Yes, question number 1.
Yeah. The placenta, it suddenly detached. Well, what you call it? Ruptured. So you're gonna have like that a lot of bleeding. So it's gonna be dark red. So you definitely need to pay attention with that because a lot of bleeding is no bueno in pregnant women.
Okay, yeah, so that's true. And the key, I know that you all got the correct answer, but I just want to make sure that you got it because you fully understand. When we think placenta previa,
Abrupto is pain, right? And previa
it,
because it's covering, there's no
Yeah.
actual pain associated with it.
Exactly. That is the point. And I want to make sure that that's clear. So if there's no pain, it's placenta previa. If it's painful, it's abruptio placentae. Now, you could see this question in a different way, right? When you have a woman that's pregnant and she has this bleeding, because we know that that's not good, just like Say said, one of the first things that you want to do is initiate an IV. We have to make sure, because we know that either I'm going to be giving a bolus of fluids or I'm going to be giving a transfusion, right? But that's going to be like a priority nursing action when I have a patient that is hemorrhaging in this way. Okay, but the big thing to remember, placenta previa, painless, abruptio placentae is painful. Okay, any questions about that? Okay, that is like an oldie but goodie, like you'll see that one for sure, probably. Okay, question number 2. Okay, I see the answers coming in. Okay, awesome. Everybody got this correct. Okay, so Sarah, walk us through it, please.
I took that as a normal finding for patients 1 hour postpartum.
Mm-hmm.
If it was over to the left, I do believe, I would ask them to void. That would help move some things around. But the where it was located and the amount they were receiving, it didn't slow down and it didn't get worse. It just was trending the way it should, if I remember correctly.
Yes, yes, and you got it exactly correct, right? And so, excuse me, whenever you have normal findings, you want to document, right? And so, of course, you're never not going to do anything. You're always going to continue to monitor the patient. And so that's one of these kinds of questions. Okay, awesome. And I'm just putting the rationales in the chat as well. Okay. Okay, number 3, please. Okay, I see Jessica's and Sarah's. Okay, Amber. Okay, we got all kinds of answers for this one. Okay, let me see. Did Bria answer? No, I didn't see Bria answer. It's okay. Commit to one. We've got everybody has chosen like one of each, so it's okay.
I feel like mine's wrong, by the way.
Well, we're gonna see. So okay, so A. All right, so let's talk about newborns because this I think was a tricky one. So the nurses caring for a newborn immediately following birth. Excuse me. So this is a priority question. So after the airway is patent, what is a priority action?
Keeping
Okay.
the warmth, right? So that's why I think it should have put B. Am I wrong?
No, you're right. Well, you're right to say B now.
The second
So
one, yeah, first. That's as soon as I read it again, I thought because you got to keep their warmth, their temperature, so you got to get them dry.
exactly. And so with newborns, besides the airway, the other thing that I'm super concerned about is cold stress because they cannot regulate their temperatures, right? And if they cannot regulate their temperature, they're going to burn up their brown fat. They're going to have increased metabolic demand that could lead to hypoglycemia. So that's cold stress is a big thing. That's why they're swaddled up. They put the hats on to keep their heat in. So that's going to be the priority action. So when you have this question, This is a priority. Okay, what's the killer answer? Okay, if this was my baby, what would I want them to do? I mean, vitamin K, yeah, it's important, but drying the skin is going to be more important. Eye prophylaxis, yeah, that's important. Identification bracelet is important, but as long as the baby doesn't leave the birthing area, then that's not really a big deal, right? But drying the skin. Okay. All right. Anybody have any questions or comments on 3? Okay, let's go to 4. Okay, say I see your answer. Okay, Amber, I see yours too. And I always want you to remember therapeutic communication. And what would you want a nurse to say to you? Or even better yet, thinking, if I was to say this out loud, how would it come across? Okay, so I see that most of you got it. D is correct, right? So this is factual. It's also thinking about therapeutic communication. It's providing an answer to the patient's concerns, right? And we're providing facts within the scope of practice. So 7 weeks gestation, urinary frequency, I saw one of you chose C. C is not correct because that's not a therapeutic response. That's really not kind if someone says that. And that's not helpful to the patient. So, and sometimes it's tough when you have these things and you're like, well, it could be true, but you never want to choose anything that's non-therapeutic and that's not providing information about the patient's concerns. Okay. Okay, let's go to question 5. Okay, Bria, I see your answer. Thank you. Okay, everybody's given that. Okay, excellent. This is like a classic question, right? A classic mother baby kind of question. With this immunization, we don't give, live immunizations to pregnant patients, right? So this is a classic one. I think you all know that. So I put the rationale in the chat, but I think you all pretty much know that one. Okay, let me just make sure, any questions about that one? Was anybody like not sure, like you knew this right away, right? Okay, okay. All right, question 6. Okay, after that other question, I know everybody would get this one. So yes, airway is the priority action. Okay, so that one, 6 was an easy one. All right, 7. Okay, I'm seeing a lot of answers coming in. Okay. Okay, good. I see everybody's pretty much getting, and it's the same answer, but excuse me. So yes, A is going to be correct, and this is a therapeutic response, right? And so when we just talked about that, and just put yourself in this patient's shoes, right? What would you want the nurse to say to you? What's a therapeutic answer? Okay, and we always want to acknowledge the patient's feelings. So I think you all got that. So that's good. All right, number 8. Okay, I see Sarah's response. Thank you. Okay, great. Okay, I think everybody got that one. That one was kind of an easy one. Okay, let's go to, we'll do 9 and 10, and then I'll flip to a case study. Okay. Okay. Excuse me. Okay. All right, super. I see everyone's getting B. Okay, yes, B is the correct choice for number 9, right? And so that is the most reliable. The IUD, it has a failure rate of 1 in 100. All the others have a higher failure rate. Male condom, we know that that's not reliable. 11 to 16 failures for every 100. But that IUD is going to be the best thing. Oral contraceptives, that's not reliable. And remember, there's some medications that can actually decrease the effectiveness. Some antibiotics, epileptic medications can affect your oral contraceptives. And if they forget to take them, that can be a problem too. Diaphragm with spermicide, that's not very reliable at all. 16 out of 100 failures. Okay. So that's good. Okay. This number 10 is the same rubella one, so I know you all know that one. Let's do 11. Okay. B. Okay. And this is one that we just talked about in the beginning. Okay, so that IV access, because I know we're gonna have to get this bolus of fluids, gonna have to do a possible transfusion. Okay, awesome. It looks like everybody got that one. Okay, so let me, any questions about this? Okay, I know we did maybe about 10 questions, but we really ranged from birth control to complications. So we kind of did a quick span of everything. So I'm going to show you how to kind of navigate this. So since you said mother baby was something that you wanted to go over, I'm going to try to find a mother baby one. Let's see. So there's an ectopic pregnancy or neonatal jaundice. That actually, I think I did that one. That's a recording, so we could do something different. Um, postpartum hemorrhage. Postpartum hemorrhage. Okay, so I'm going to get the answer, but the answer key, but I'm going to keep it off to the side, and I'm going to kind of show you how you can do this if you're studying on your own. Okay, so I'm going to keep that off to the side, and now I'm going to go under Next Gen NCLEX Test Bank, and I'm going to find, I'm going to look for post, okay. Okay. All right, maybe. Okay, element P. That's not what I want. Okay. Why do I not see this? Okay. Something happened. I don't know. Okay, so all right, I'm trying to get to the postpartum here. Okay, we're at PEs. Post-op, post preeclampsia. Why is it not showing? Okay, just give me 1 second because I know I've did this one before. Let me see. I don't know why it's not working. Okay. Hemorrhage. Okay, all right. I have no idea why it's not finding what I needed to find. Okay, but we can still kind of go through it though. Okay. I'm thinking maybe it's just showing med surg for some reason. Okay, there's ectopic pregnancy, so that's not true. Hemorrhage, hemorrhage, hemorrhage. I think I'm just missing it. Okay, for some reason. Neonatal jaundice. Okay, I know y'all really wanted to do that. What's the second choice? For some reason, I can't get to the postpartum hemorrhage. What's the second choice? Is there anything that you saw that was interesting to you?
You want to do the preeclampsia since I see it?
Okay, yeah, that's a good one. Okay, so preeclampsia. All right, so we've got it open. Okay, so once you see it, you click on it, and when you're in the student view, that's how you get to the actual case studies. So I'm just going to copy this so I can bring it to my other screen. Okay. And all right, so when you have this, I always remind students or graduates to read the whole thing. And every time you have like another question, make sure that there's nothing new. Like, excuse me, make sure that there's no new information because that could affect how you answer the question. Okay, so I'll give you some time and let's see. Does anybody want to read this through out loud for everyone? This is a preeclampsia. Okay, Sarah, I think you're unmuted. Are you reading this through for us or?
I am not. I don't know how I'm unmuted myself. No, ma'am. I'm reading it though.
Okay, okay. Okay. So, how these work, so I know that you are looking at it. So this is case study question 1 of 6. The nurse is caring for a client admitted to the labor and delivery unit at 35 weeks gestation with preeclampsia. This is a good time if you're like, man, I don't remember anything about preeclampsia, just to go to your like I would probably look at your Hearst book. Not your Hearst book, your Hesse book, the green Hesse book, because that's a thin book. You don't necessarily want to have to go back to your textbook because, you just want the quick information that gives you the highlights. Because I think once you see it, it will come back to your memory. Okay. So, the admission note, 845, 29-year-old prima gravida, 35 weeks gestation, severe preeclampsia. Plan is magnesium sulfate for 24 hours, followed by induction of labor. Okay, so that's nothing too remarkable. I would expect that, right? And if you don't remember about mag sulfate, that would be a good time to look up mag sulfate again, right? And so this is your flow sheet, tells you 9, 10, 11, and 12, what's happening with the patient. So I like these kind of questions because it's kind of like in real time, you're caring for the patient and it's kind of unraveling or not unraveling, but revealing itself. And of course, we know reflexes is a big thing. The heart rate is a big thing we have to monitor. Excuse me. And when you see at 12 o'clock, that's going to be a little bit cause for concern, right? That heart rate is up. And so, what I really like how Erica analyzes this, like when she looks at it, she's thinking aloud and she's like, okay, wait a minute, 12, she'll be like 12 o'clock, something's not quite right. In the beginning, the blood pressure was elevated, the blood pressure's coming down now. Okay, the blood pressure is way down, but the heart rate's up. Now we have tachycardia. So that could be a little bit of a red flag. And so just thinking it through what this information means, because that's going to help you. Now looking at the respirations at 12 o'clock, now it's 11. So that's going to be a cause for concern. And I'm thinking, is it, mag sulfate toxicity? What's going on? Then I look at, okay, the urine output, it's decreasing. And I know the magic number is 30 mLs per hour, right? I look at 12 o'clock, this is 20 mLs. That's not really reassuring combined with all the other information about this patient, right? So you're just kind of looking at it and analyzing it just like you would be in a clinical, probably. Okay, and the fact that the patient has shortness of breath, that's also concerning at 12 o'clock, right? Coupled with all the other things. So at 9 o'clock, the 4-gram loading dose of mag sulfate started. It ran over 20 minutes. Okay, so that's the loading dose. A second nurse verified the pump settings. That's normal because this is a high risk medication. Client educated on the side effects. That's normal, right? We will want to do that. There's a headache, no nausea, vomiting, no epigastric pain, no visual disturbances, right? And that tells us, if your patient had visual disturbances, that could be a sign that their blood pressure, their preeclampsia is getting worse. So that's good, right? That they don't have those things. Okay, acceleration's present, deceleration's absent. So fetal monitor shows the baseline heart rate 130. That's normal, right? Moderate variability. Mag sulfate at 920, the loading dose is complete. Okay, so now we're not doing the loading dose, we're doing 2 grams per hour continuous infusion. And second nurse verified, okay? So 11, noted to have cutaneous flushing and sweating, fan brought to the bedside. Okay, so that's, okay, a little cause for concern. And then 12, absent patellar reflexes. Respiratory rate is decreasing, 11 now. Complains of shortness of breath, pulse ox 92. Okay, so there's a lot going on with this patient, right? So this is one of those questions you're going to have to click to highlight the 4 findings that are the most significant. Okay, so let's go around the room and everybody give me one thing that you think is significant in this flow sheet.
Well, the respiration to 11 at 12 o'clock is significant in my opinion.
Okay,
I think the shortness of breath is significant as well.
okay,
Her O2 set went down.
And heart rate. No, the absent reflexes.
Yeah.
yeah, the absent reflexes. That's a big thing. And so I think you all got all, wait a minute, let's see. The shortness of breath. Okay, yes, shortness of breath.
The decreased output is concerning.
Yes, that's right. Okay, so the answer is going to be yes, the reflexes. And so basically, this question is testing you on this first question. Do you know about mag toxicity? Can you identify if a patient is going into magnesium toxicity? So, yes, when we know mag sulfate, we always wanted those deep tendon reflexes. You probably remember your instructor saying deep tendon reflexes, right? And then you should recognize for any patient that doesn't have a respiration in normal limits, right? And then the urine output is not within normal limits. The shortness of breath, of course, is like the big red flag. So that's going to be, those are the four things. So when you do this, you can do all the 6 questions and then look at the answer key. Or you can, if you're going to be true to yourself and not like look ahead, um, and then you could do it that way, or you could do it one at a time. So it's going to be up to you. Okay, we're going to continue. So this is part 2, right? So this is the same patient, same admission note, same flow sheet. That's not changed. So and again, always check. And I know this doesn't have the tabs, but like you probably used to the tabs, like you had them when you did your test, right? So you make sure that you click all the tabs, any new information. Okay, so this is asking what additional assessment data should the nurse obtain? This is a select all that apply. Okay, so fetal status, breath sounds, pupils, level of consciousness. What do you,
Definitely.
Fetal status and level of consciousness.
Yeah.
okay,
Let's go with
Wonderful sensation.
hold on. Let's go with breath sounds.
Yes, that's right. If my patient is telling me they've got shortness of breath, I better do a respiratory assessment. I better listen to their lung fields, right? So yes, so that is all that you need to, that's the additional assessment data that you need. The fetal status, is the fetus okay? The mom is starting to go down and I'm automatically worrying about the fetus, right? So very good. Fetal status, breath sounds, and level of consciousness. Because again, this is a magnesium sulfate toxicity kind of question. Okay, so I know that that is what I have to focus on. Okay, here's question 3. Same information, right? The admission note is the same, flow sheet is the same. I'm checking to see if there's any new nurse's notes. Now this question is a drag and drop kind of question. Drag the most appropriate word from the choices to fill in the sentence. Okay, so what's going on with this patient?
The magnesium toxicity.
Yeah, that was an easy one. Okay. Yeah. Okay. Another way that you can study with this, because I know you all said that you want to practice mother baby, is to look up placental abruption, look up eclampsia, look up, PE, and in terms of pregnancy, and make sure you review that because it could be you can see this question in different ways. But so that was an easy one. Okay. Question number 4. Admission notes the same, flow sheets the same. There's no new nurses notes. Now, this is one of these kind of, you got to check if it's indicated or not indicated. So for each potential intervention, click to specify whether the intervention is indicated or not indicated in the plan of care. Based on what's going on with this patient, should we stop magnesium infusion? Is it indicated or not indicated?
Indicated.
Indicated.
For sure, right? Okay, what about calcium gluconate?
Indicated. Yes.
Because that's the antidote, right? Okay,
Right.
what about place decline in supine position?
No.
Oh,
No.
Okay, yeah, and we never gonna put our pregnant patients in a supine position, right? That would be horrible. Okay, left side elevate the hip is what we want. Okay. excuse me, activate rapid response.
No.
I'm not sure. Is that
I don't think
entirely
so.
needed?
I think I would, just because she's on the verge of respiratory
Yeah, that's like a
arrest.
medical
Not
emergency,
even distress.
right?
She's in distress. She's on the verge of arrest.
Yeah, she is crashing. Okay. So, and remember, with our pregnant patients, we are also not just having her crash, but then her fetus is going to be in
Yeah.
danger. So, we already know that her respirations are not within normal limits. So, for any patient that they're not in respiratory, normal respiratory status, I would activate a rapid response. This just happens to be a pregnant patient, but she has shortness of breath. Her respiration's 11, and she just happens to be a pregnant patient. But if this was like a med surg patient, you would definitely activate the rapid response. Okay, and I know at clinical they said it's better to activate the rapid response and not need it than not activate it. Okay,
Yeah.
provide oxygen.
Yeah.
Yeah.
It's
Yes.
indicated. Okay, monitor the fetus.
Yeah.
Yes.
Yes, administer anti-seizure medications.
No.
No.
No,
No.
she's not having a seizure, right? This is the actual opposite. She is
Right.
has the mag toxicity. Okay. Draw serum magnesium level.
Yeah.
Yes.
Yep. Okay. Check for medication error.
Yes.
Yes, because that
Oh,
could be, yeah,
Because we
because
could have
that,
done the wrong dose or something.
yes.
See, and I wouldn't have thought that because I
I
saw
want
they
to say because they
had
lowered it
two
to 2.
nurses verification for both times. So I wouldn't have
Yeah.
thought.
Yeah.
That's what I was like, no.
Well, I'm going to tell you, it's always a good thing to check for medication error, even though it was two nurses, because it could happen. Both of them could make a mistake. And if the patient is crashing, we have to figure out why, right? We have to figure out why. So checking for a medication error is a good thing. And then elevating the extremities, is that indicated or not indicated?
Yeah, because you ain't putting them in supine position, so you might as well.
So this is saying that it's not indicated because
Oh, yeah.
elevation of extremities is not what we do for magnesium toxicity. Okay, so in this it's not indicated. Okay. All right, so that's just another kind of style of question that you could see. Any questions about this? Okay. All right, we're almost done. I think we are at question 5, and then because there's 6 questions. Okay, so again, looking for new information. Okay, no new information. So which 3, okay, sorry, my internet is unstable. I probably have too many tabs open. Which 3 actions should the nurse take first? I'm gonna let you all.
Stop the
Copy
infusion. for sure.
infusion,
That's for sure.
administer
oxygen.
calcium,
Monitor that fetus.
Manja fetus.
and administer the calcium.
I think so, yeah.
It
Okay.
said 3 actions. Oh Lord.
Yeah, 'cause I don't know why I want to give her some oxygen.
I think we're gonna change the calcium to provide oxygen.
Okay, so you say provide oxygen.
He said we can only do 3. That's why I was changing it. I don't know.
Mm-hmm. So what's the 3 most important things?
I think for me, I would say stop the infusion, monitor the fetus, and activate a rapid response. That's my first 3 things. And then I'm going to look at the other things that I can do while I'm waiting on the team to get there.
I fail.
Okay, so I like what
But
Jesse said.
Also, I can put the oxygen on and then I can call for the team. So I'm in between there.
Okay, so like I know in real life we would be doing all of this at once, right? But
Yeah.
so in these questions, it's like, okay, if you could do these 3 things and then you were gone, right? What would be the most important things? So definitely stopping that magnesium because we know that their toxicity. Yeah, we got to monitor the fetus. That's important, but that's not the priority right now. And I know that sounds really bad to say. Um, Check for medication error, that's not a priority. We would eventually do that. Providing oxygen, we would eventually do that. administering the calcium gluconate, that goes with stopping the infusion because we know that this is toxicity, and whenever a patient is toxic, we need to get that antidote. And Jesse, you already mentioned that, hey, this is a rapid response scenario. So I need to get help moving towards this patient. And as the help is coming, then I can do the oxygen and all that kind of other stuff, right? So if you could do, this is kind of like a priority on steroids, like what is the nurse going to do next? But this is also telling us that, okay, these three things, what are the most important three things out of all these things on the list? Okay, so instead of one priority, it's three priorities, like the top three. That's just a way to think of it. So the priorities is to get help, stop the infusion, and administer the antidote. Okay. And so immediate. Okay. Any questions on this one? All right. Last question. All right. So admission notes the same. Excuse me. We have a new column on the flow sheet. So take a look at that. 12:15, we're not giving any mag sulfate at this time. There's still no reflexes. The blood pressure is similar. The heart rate is similar. Respirations similar to 12 o'clock. Let me
But
see.
that oxygen's worse because for 93 on 10 liters, you're 92 on Romero. You're getting worse.
Yeah, okay. Urine output's not measured, still has shortness of breath. So this flow sheet, I don't like this 12:15, right? I'm getting a little nervous here. Well, I was probably nervous already with everything that was going on. Okay, so 12 o'clock, okay, let's see. 12:05, infusion stopped. Rapid response activated. Calcium gluconate given. Stat serum magnesium drawn. Fetal heart rate 105. Oh man, right? So that fetus is starting to go down. Client placed in the left lateral position, lungs cleared to auscultation bilaterally, client given oxygen non-breather, excuse me, 10 liters per minute. 12:10, fetal heart rate returned to baseline, moderate variability, no decelerations, okay. 12:20, a BP 108/75. Okay, shortness of breath continues, blah, 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 right? Fetal heart rate 125 with moderate variability. Okay, so the fetus was going down, but it looks like the fetus is coming back. So that's reassuring for the fetus. Okay, so here's the orders. Stop magnesium sulfate, calcium gluconate, IV, right? Okay, magnesium level stat, administer oxygen. Okay, so this question is asking, the nurse reassesses a client 15 minutes after implementing the treatment plan. Complete the following sentence by choosing the list of options. The nurse determines that the client's status is
Unstable.
Unchanged.
okay, unchanged. That's right. So the patient is herself is unchanged. The fetus is actually improving, but the patient, the mom is unchanged. So now the nurse should do what? What should she do? Should she sorry,
More calcium?
yes, because it's still toxicity, right? We need to
Okay.
get more additional dose of calcium gluconate. So the other choices were resume magnesium sulfate. You would just be a bad nurse if you did that, right? Transfer the patient to intensive care unit. I mean, okay, she was going downhill, but not necessarily for ICU. Not, but if we give her more magnesium, she's definitely going to be headed to the ICU. So request additional calcium gluconate. That's the correct answer. Okay, so this at the end, you'll get all of your answers that you chose. And that's one way you can go back and check your answers since you have the faculty way to look at the documents with all the answers and rationales. So you could choose to study it this way. Okay, any questions or comments? I'm going to stop sharing and get some feedback from you all on this. Okay, I'm gonna